The most shocking fact about prostatitis, my beloveds, is that in over 90% of cases there is no infection to be found. Yeah, and the debilitating pain is often the result of a complex psychoneuromuscular disorder, so a vicious cycle between the brain and the pelvic floor. So the vast majority of prostatitis cases are actually chronic prostatitis, chronic pelvic pain syndrome. That's right. CPPS, yes. When diagnostic tests are run, they find no bacteria. The problem is not an infection, but a disorder of the brain-pelvic floor connection. So it's a two-part problem, the somatic body. That's why it's psychosomatic. Huh? So somatic is a body. The pelvic floor muscles are in a state of chronic unconscious tension or spasm. Not subconscious, actually, leading to nerve irritation and real physical pain. And psycho, mind. So soma is a body, psycho is a mind. This process is profoundly influenced by the brain. Stress and anxiety are the #1 triggers, causing the pelvic muscles to tense up even more. Over time, the brain itself can become hypersensitive to signals from this area, central sensitization, interpreting normal sensations as severe pain. This creates a self-perpetuating vicious cycle, causes anxiety, and anxiety causes more muscle tensions and pain. So it's a brain muscle problem, not an infection. The root cause is not a bug in the prostate, but a dysfunctional feedback loop between the nervous system and the pelvic muscles. That is why antibiotics, the go-to treatment, are usually completely ineffective. The pain is real, but the cause is invisible. The patient's pain is absolutely real and can be debilitating, yet the standard tests for infection or inflammation come back negative. The problem is the wiring, so-called wiring, and the muscle tension, not a pathogen that can be easily identified. So, treatment requires a normal, holistic approach. The cure is not a pill, but a multifaceted approach that breaks this cycle. This often includes pelvic floor physical therapy to release the muscle tension, stress management, cognitive behavioral therapy to calm nervous system, and sometimes low-dose neuromodulators to address the nerve hypersensitive, or just herbal therapy. Actually, herbals always start in these cases with herbal therapy, if there is no bacteria, of course. Okay, stay blessed.